Essentially, the Return to Play program is one of the exciting aspects of our sports medicine rehabilitation program. At Mercy, we combine both the physicians and the operative, non-operative services we provide, along with our physical therapists and our athletic trainers, in helping our patients recover from surgery and to achieve their goals to get back to whatever level of activity they desire. Well, the nice thing about it is that in many of our locations, our therapists as well as our athletic trainers and our physicians share the same physical space. So there's a lot of personal interaction between the different parties that are able to collaborate on the care that the athletes receive. And when you look at it, essentially, when an athlete's recovering, there's three phases of recovery. One is the recovery from injury or surgery, in which case you're doing therapy. You're reducing swelling, you're getting motion back, you're restoring strength. The next is the rehabilitation phase, where you're actually trying to get them back to a level where they can start doing some training and they can start doing some progression back towards their sports. And then the key component that we have here is our GAP program, which then fills the space between the time someone has maybe completed what they can do with bands and with weights and actually puts them on a field. We're able to look at their coordination, we can look at their balance, we can look at their endurance, and we can look, most importantly, at their confidence, things that we can't really assess just seeing someone in the office. And again, that's where that teamwork comes into play. There's a lot of communication back and forth. We have developed protocols for many of the surgery, in fact, for most of the injuries that we're going to see athletes for. Certainly for all of our surgical procedures, whether it be a shoulder stabilization, whether it be an ACL reconstruction, whether it be some sort of meniscus repair or cartilage damage, there are specific protocols that are in place as to how those patients should progress. When can they weight bear? When can they start doing strengthening? What kind of strengthening can they start doing? When can they start doing impact types of activities? And then when can they progress back to change of direction types of movements? And so the nice thing about this is that from the start, the physician is involved in developing those protocols along with the physical therapist. And then we also have relationships with our athletic trainers in all of our high schools. And what we try to do is to outsource as much of that functional training where they can get back on a field, where they can run, they can cut, they can jump, they can be on a court, they can shoot, they can do the kind of things, the kind of motion patterns that they need to be successful in their sport that you really can't just replicate in a building. I think when you look at the developments in sports medicine over the last probably 10 years or so, determining appropriate return to play criteria or return to sports criteria has been very exciting development. Again, when you're looking at an athlete, the determination as to whether or not they can return to play depends on, number one, how well things have healed up, so their biologic healing. Number two, how their knee or how their joint holds up with regard to inflammation. And then the final part is, what is their confidence in coming back to play? All of our young people, especially after lower extremity injuries, are at higher risk for re-injury. And these kinds of programs are designed to help, number one, reduce them to the same level of activity where they were before, but then also help prevent their re-injury rate. The things that are associated with re-injury, especially after an ACL reconstruction in young people, is age and their activity level. So when you're looking at high schoolers, when you're looking at college students, those folks are going to have the highest activity level. They're going to have the highest re-tear rates, which in some cases for something like an ACL reconstruction can approach 30%. Being able to have them do a more supervised training program involving jumping, cutting, twisting, turning, monitoring endurance, monitoring balance, and monitoring their confidence has been shown to be able to reduce those re-injury rates and have a higher success in returning them to their same level of sport.
The experts at Mercy Health Sports Medicine and Rehabilitation provide the most comprehensive level of care in the region. For more information, visit mercy.com/ortho.